Thank you very much. Yeah. So we will start our talk. The topic of this presentation is natural biomaterials of bioengineered scaffold as skin substituents in the management of chronic wounds. So the topic itself describes what is meant by natural biomaterials. So here the biomaterials is nothing but a substance that can be synthesized naturally, or it can be synthesized in laboratory through some chemical process or isolation from the natural available materials that can be incorporated at the particular place of a system where it can be able to regenerate the skin as well as the tissue or bone region. So that is the definition for these biomaterials, and the healthcare application which I am going to talk today is relevant with the chronic wound management study. So generally, before I'm going to this, what are the aspects in our lab we are focusing is biomaterials and tissue engineering. There are several fabrication techniques we are utilizing, such as 3D bioprinting, freeze drying, and salt gel method, and followed by the biomaterial properties, which include the biocompatible, biomechanic, biological stimuli, and biodegradable and porous material. Apart from this, the raw material we are using is bioceramics, nanoparticles, and biopolymers, which has been commercially synthesized as well as isolated in our laboratory. And what are the different types of materials we are using is composites, biphasics, drug-loaded scaffolds, and hydrogels. So if you come into the application point of view, there are 5 applications which I'm going to talk today. Not today. Today I'm going to talk majorly on wound healing aspects. Apart from that wound healing, we are doing some preclinical research in animal-based models, such as critical size bone defect model in bone, and also as well as the chondral defect in rat animal model, and the dental pulp regeneration with the collagen-based materials for the alternative therapy for root canal treatment. And also we are doing that management of arthritis management. The reason is arthritis, if you go for a diagnosis with the clinicians, they will do with gadolinium, that is high metal compound. So if you use the frequent combination of these high metal compounds, that will lead to the ultimately for the kidney damage. So to overcome this, the arthritis management, we use the contrasting agents with a naturally available polymer material. One of the material we used and patented is a fiber-based compound material that can be able to detect the diagnosis, and it is not for the treatment option, it is only for the diagnosis. So this is the overall research in our lab. And particularly, I'm going to talk about more on wound care. So before going to these, all the research and activities or R&D results, I just give you a brush up on this brief introduction about the wound care management. So if you take the global healthcare burden, and more than 100 million individuals were suffering from pre-diabetes and diabetes. So many features influences the market growth, such as disease like cancer, diabetes mellitus, and autoimmune diseases, and unhealthy lifestyle habits like smoking, high alcohol consumption, unhealthy diet, and stress and drug abuse will be the influential factors that has been affected during the wound care. This is the compound annual growth rate. We can able to see the 7.6% percentage of increase from the 27.8 billion by 2026 from the US dollar 19.3 billion in 2021. So very simple, wound is defined as a break in the epithelial integrity of the skin due to physical, chemical, thermal, or any microbiological or immunological insult. So if it is take type, there are 2 different types of wound. One is acute wound, sudden, healable within the period of time, and chronic wound take much longer time. But also it is a result in a specific diseases. One of the reasons is the diabetes that leads to ulcer. So now coming to the acute wound, it's one of the trauma or injury. So what happens? They heal in controlled and stable microenvironment where cellular communication is clear, uninhibited. So the balance between the process of cellular destruction and synthesis of new cells. Whereas in the case of process of wound will take place in a structure and timely, uneventful manner. So it will take healable within 8 to 12 weeks. Next, coming to the chronic wound, is a condition that arises in the typical wound healing cascade fails to progress or disturb. The most common chronic wounds are diabetic ulcers, pressure ulcers, and venous ulcers, which I am going to discuss briefly in upcoming slides. So what happens? The excessive inflammation is happening that results in the failure of the chronic wounds. So that will lead to the out of control of this chronic wound healing process. So the neutrophils at the site of the injury releases a significant amount of enzymes such as MLTs, which are not balanced by their respective inhibitors. So as a result, the balance between matrix degradation and synthesis shifts towards degradation. So this is a very basic physiology in normally happening in our system. What is the different process? Hemostasis, inflammation, proliferation, and remodeling. Each process will take particular minutes. Initial stage, hemostasis 1 to 6 minutes, 60 minutes, inflammation 5 days, where it involves the homeostasis, phagocytosis, where the macrophage differentiation is happening, followed by the proliferation happening between 2 days to 3 weeks, where the reepithelialization, angiogenesis, nothing but the new blood cell formation, and one of the important component ECM is the collagen. These synthesis will be happening in the proliferation phase. Followed by the last phase is the remodeling phase, where it will take 3 weeks to 2 years depending upon the injury and also the condition, where the maturation of the scar tissue formation and more the increase the tissue tensile strength, vascular maturation, and collagen remodeling is happening in this phase. So these are the 4 different phases happening in the wound healing. So these are the sequential illustration of the different stages which I have been talking: hemostasis, inflammation, remodeling, and proliferation. First step, hemostasis is the first stage, or any acute or physiological wound healing happening. What will happen? Vasoconstriction occurs to minimize the bleeding and assist with initiating the clotting process here. So the fibrin clot has been formed and temporarily closing the wound. While the clot forms, the blood or the serous fluid. The serous fluid is nothing but the yellow color fluid. It has been happening when we got injured, may exudate from the wound as the body tries to cleanse the wound naturally. The second step, followed by the inflammation, is a first type defense system. It generates free radicals, high level of proteases, enzymes, cytokines that destroy the cell debris, microorganisms through phagocytosis process. Whereas heat, redness, pain, swelling, and some loss of function occurs as the vessels around the wound dilate. So in this place, the macrophages play an important role that clear the wound debris to prepare a new tissue formation and facilitate the inflammatory healing phase to the next phase, such as proliferation phase. So the proliferation phase, where the different growth factors stimulate the fibroblasts and myofibroblasts present in the surrounding tissues to proliferate, and this phase itself in the formation of the collagen synthesis, deposition, and also initiating the wound contraction. So the epithelialization process is a crucial process for the successful closure of the wound. And also it helps the releasing the certain stimulation molecules, migration, and epithelial size on the wound site. Followed by the angiogenesis process, lost until the blood capillary network is re-established that will be able to supply the metabolic needs of tissue organelle. The last phase is the remodeling phase. This generally is the final stage of phase. So it is depending on the granulation tissue formation get matured, and this may continue for 1 to 2 years or even more prolonged depending upon the injury. So what happens? The newly epithelialized wound tissue has only about 25% of the tensile strength compared to the normal tissue, which improves by increasing the covalent cross-linking of the collagen molecule through reorganization of the collagen fiber. So these are the different step process we discussed. Now, what are the factors that affect the wound healing? If you take the common factors I pointed out here, any infection, ischemia, low level of oxygen supply, and any metabolic conditions or any immunosuppressive drug or the radiation. So these are the factors that affect wound healing and contribute to the pathogenesis of the chronic wounds. So now I will discuss deeply about the type of chronic wounds. We are going to discuss 4 different types of chronic wounds, such as pressure ulcer is nothing but name itself showed as a bed sores or decubitus ulcers. So here the injuries to the skin and underlying tissue resulting from prolonged pressure on the skin, where the bed sores most often develop on the skin that covers especially the bony areas of the body, such as heels, ankles, hips, and tailbones. Okay, so this is the reason for these pressure ulcers. And the second type is the diabetic foot ulcer, where we can etiology is very multifactorial components. The common underlying cause are poor glycemic control. So the patients having the poor diabetic control causes foot deformities, improper foot care, ill-fitting footwear, underlying the peripheral neuropathy, and that leads to the poor circulation to the tissues, dry skin, etc. That leads to the diabetic foot ulcer. The third one is called as a venous ulcers. So we can see that from image itself, it is a source that take weeks or sometimes months to heal. They can worsen quickly, putting you at risk for complications that cause some people to lose their limbs. With the successful treatment, you can avoid these type of issues. And the last one is the arterial insufficient ulcer. It is nothing but open sores found on the body. They often form on the lower extremities such as legs and feet, if you can see from the figure. So arterial ulcers develop as a result of damage to the arteries due to the lack of blood flow to tissue. Unlike other ulcers, these leg wounds can take months to heal. If they heal at all, though similar, they require a different treatment to ensure the proper healing and a speedy recovery. So while we talking about different wound healing process, now this table will show overall the commercial products that has been available in the market for this wound healing process. Different companies in the brand name: Episil, Integra, Evagraft, Allodem, Orsal, BioBrain, Apigraft. And if you see the what are the components, one of the most of the components have been enriched with the collagen and fibroblast material that can be incorporated with allogenic dermal fibroblast cells or spongy layers or chondroitin 6-sulfate. The glycosaminoglycan component has been enriched with the different companies. So this is a very basic. What is a diabetes mellitus? Most of us are aware. According to this WHO organization, globally 432 million adults are living with diabetes mellitus. Two types of diabetes: type 1 and type 2, insulin dependent and insulin non-insulin dependent. So uncontrolled diabetes mellitus may cause many complications, and one of the most serious complications is the diabetic wound, which we are going to show in an experimental model. So what are the risk factors? It produces impaired wound healing is the leading cause of high amputation rate in the people with the diabetes patients. It produces high risk of recurrent hospitalization and long-term negative effect that will result in the morbidity and mortality as well as the social economy. So what happens in diabetics patient due to the infection? Inflammation leads to the imbalance matrix muscular proteases and ROS and the other growth factors get degraded. So the normal process of the angiogenesis, blood vessel formation is impaired, and cell recruitment to the wound site is inhibited. So now coming to the topic which I was talking initially, what plant polyphenols play important role, because this is a naturally available material. So generally, if you take any plant-based polyphenol, there are several reports has been reporting based on this antioxidant and pro-oxidant activity, such as immunological, antifungal, antimicrobial, wound healing, antiviral, anti-cancer. So the only disadvantages or limitation, if you use a plant-based polyphenol alone, there is what is we can say is the drug delivery or the half-life of the plant-based polyphenol get decreased. So nowadays, most of the researchers have been used the nanocomposite-based drug delivery approaches of this plant-based polyphenol will enhances the sustainability of the drug delivery and also the efficiency. That is called the drug loading efficiency. So that is why we use the plant-based polyphenol in our study. So this is the general idea or the promising avenue of therapeutic solutions for wound care, the polyphenols. Generally, the plant-based polyphenol compounds provide, as I shown in the previous figure, with a lot of biological activity. And also the polymer-based biomaterial prevents the quick release, which I told, the bioactive compounds from the wound site by maintaining the drug release kinetics. So at the end of the day, the polymer-based biomaterial helps to improve the drug stability and effectiveness at the wound sites and play an essential role in the healing process. So before going to this any plant-based material or any biomaterial-based material, what are the strategies has been used nowadays for these? There are three important strategies where clinicians will use tissue-derived model, whereas we use the preclinical model in our laboratories, hydrogel-based and the controlled release of signaling molecule. This is two different approaches where we have done in our laboratory. And this one requires more human ethical approaches. So this one will be done most of the hospitals related research institutes. So if you see the tissue-derived model that has been dehydrated human amnioin or chorion membrane allograft has been used frequently, and cellulized placental membrane CPM and porcine small cell intestine submucosa and cadaveric allograft. This is for the tissue-derived where that can be incorporated at the site of injury. So in our lab, we use hydrogel-based solution, whether we use the materials are cross-linking to increase the efficiency or mechanical strength of the proposed material, and freeze drying, dehydration, and electrospinning. These are the approaches we use. At the end of the day, we use the spongy substances or patch substances that can be incorporated with cells or without cells. This is one approach. And sometimes We use the nanoparticle-based drug delivery also, or sometimes the recombinant-based vector-based encoded functional molecules, or growth factor chemokine preloaded with hydrogen for the controlled release of signaling molecules. So these are the three different approaches totally has been used for the treatment of the biomaterial-based diabetic wounds. So I'm going to now discuss the research, what we have done, especially one of my PhD students done this study. Two different chapters which I'm going to discuss this presentation. This first chapter I'm going to talk about the polymerase scaffold of gallic acid loaded chitosan nanoparticle that has been infused with the collagen fibrin for normal and diabetic wound dressing application. Okay, so this is the nanoparticle based drug delivery approaches. So what we have done, this is the overall graphical abstract or representation we have done in this chapter. So we use the chitosan, it is the polymer that has been available from this marine source, and polyphenol gallic acid, which has been cross-linked with the tyrosine pyropolyphosphate. That is the chemical cross-linker. Once the chitosan solution has been formed, then this gallic acid, total gallic acid incorporated chitosan nanoparticle has been completely characterized by different particle size, zeta potential, FAR, XRD, and SEM, talked by the in vitro and then preclinical study. So hereafter, I'm going to talk more about some chemistry and followed by some biological and biochemical analysis. So I'm going to this gallic acid. As I told, it is a very potential biological functional molecule. Structure, if you see, is 3,5,7-trihydroxybenzoic acid, and it is most ubiquitously found in fruits, vegetable, herbal medicine, grapes, walnuts, pomegranates, and tea leaves. So in this present work, we used this gallic acid that has been loaded with CSNP. CSNP is nothing but chitosan nanoparticles for wound healing application. So this is how we prepared this solution. Initially, we prepared this chitosan solution. Then it can be incorporated with the TPP as a nanoparticle carrier. So some of the material we used to make as a biomaterial here, I have shown the type 1 collagen that we synthesized, isolated, purified in our laboratory. So there are other sources from the bovine animals such as bovine tendon or goat tendon are highly or richly available. So for convenience, we use the control animals from the Swiss albino rats, rat tail tendons for the isolation. These are the different procedures. Once we isolated spur dichromism and as well as a sodium rhotacyl sulfate analysis, STS page has been done to show the purity of the prepare. The other material which I showed in previous images is chitosan. This is the waste to wealth aspect. The shrimp waste has been collected, washed, dried, and has been treated with the demineralization process followed by the deproteinization. Then is the chitosan powder. It's nothing but D-glucosamine and N-acetyl D-glucosamine unit. This is the polysaccharide. So these are the materials we use. And one of the important material is the fibrin. Fibrin is nothing but angiogenesis process. It will help in the new blood vessel formation. And moreover, these fibrin act as a delivery factor. And apart from our wound healing study, if you take commercially available clinicians, they use as a tissue sealant for the surgery aspect, hemostatic devices to control the bleeding. And also some of our open heart surgery is a major surgery. They are using as a construction of a tissue engineering vascular grafts. So in our study, we isolated these isolated fibrin from bovine blood, from the heteros certified by the veterinarian. Then we purified and we make it as a white color spongy powder. Then we confirmed through several analysis. So now coming to the important parameter. So as I told, the polyphenol is low, availability, stability is very less. We initially, as I told in the methodology, we first want to make sure the nanoparticle synthesis. So four different parameters, particle size, polydispersity index, zeta potential, and red encapsulation, which I'm going to detailedly discuss now. So here we use the different concentration of chitosan and TPP for nanoparticle synthesis as shown in the table. It was observed that size of the nanoparticle depends mainly on the concentration of the chitosan and TPP used in our study. So when we increase the concentration, the nanoparticle size also increases. But this increase of the size was found only up to a certain extent because aggregation has been happening. So the average diameter of the gallic acid encapsulated chitosan nanoparticle increased when compared with the non-loaded blank chitosan nanoparticle. The next important parameter, if you see the polydispersity index, is closely associated with the nanosize diameter, which indicates a measure of dispersion, homogeneity, heterogeneity. So the average values ranges from the point means 0 to 1. Here we can see maximum it will be up to 0.3 indicate the homogeneous dispersion. If the values is greater than 0.5, it indicates the heterogeneity that will result in the unstable of the nanoparticle. So the zeta potential value of these all the nanoparticle was found to be positive. In general, the value of zeta potential is considered as the stability of determining factor that will come between minus 30 millivolt to plus 30 millivolt. It is ideal for any physical stability of the nano emulsion. So when we increase the concentration of the titration, this beta potential also increase. So if you see up to 0.4, we can able to do the better stability as compared with any 0.5 concentration. Finally, the drug encapsulation efficiency is an important parameter in drug delivery system of nanoparticle. This GA, gallic acid encapsulation efficiency of chitosan nanoparticle increased linearly with an increase in the concentration of the chitosan. And also the increase in the encapsulation efficiency results from the increasing the weight by weight ratio of the chitosan TPP, which may be due to the greater level of amino groups available in the chitosan for interaction with the loaded drug. So all these parameters suggest the 0.4% of the concentration will show the better efficiency. Followed by these characterization of the physiochemical characterization, the next study is the differential scanning calorimetric analysis.